Welcome to the #Wednesday weekly session. It's the risk assessment training with Alison Glover, who is the Health and Safety Manager at Tameside Council, the Health and Safety team. I'll hand over to Alison. If everybody could please keep your mics on mute. Okay, Alison.
Okay, hi everybody. Thanks for letting me come along and do this risk assessment training for you. Obviously, risk assessment, not the most scintillating of subject, but I hope to try and make it a little bit interesting and maybe simplify it a little bit as well, because I do know for a lot of people, risk assessments, they are quite daunting in many ways, and really we can make it quite simple and straightforward. Now, there might be some of you on today who are totally comfortable with risk assessments. I make no excuse that I'm going to go right back to basics just because I do want to simplify. Okay, so we'll move on. So what is a risk assessment? Well, it's a careful examination of what can cause harm to staff, volunteers, or anybody else who may be affected by what you are doing or what an employer is doing in their work activity. It helps us to identify who can be harmed and how they might be harmed, and to weigh up whether we've got the right precautions in place to keep people safe, or whether we actually need to do more. And really critical to this is it's a legal requirement. We have to do it. So moving on from that, why do we complete the risk assessments? Well, let's take that legal reason first of all, because above anything else, that is the main reason we have to. And within the Health and Safety at Work Act, there's a requirement for employers, and that would cover also any groups operating. It isn't just a physical workplace, let's say, and that gives a responsibility to ensure that employees are kept safe and healthy while they're working. But also there's a requirement to ensure that what you're doing, your undertaking, doesn't impinge on the health and safety of other people either. So that might be members of the public, it may be contractors that are coming to where you're carrying out your activity, and of course it's your service users, it's your people who are engaging in what service your group is delivering. Now, specifically, there's another piece of legislation. Now, don't worry, I'm not going to go all geeky and go into every little bit of legislation, as much as I would love to. I'm not going to do that. We've got the Management of Health and Safety regulations, and that specifically asks that organisations carry out and document a risk assessment. Now, you only need to document the risk assessment if you employ 5 or more people, or if your organisation has 5 or more volunteers, let's say, because a volunteer is classed as an employee for the sake of what we're talking about and for the sake of health and safety legislation. Now, even if you say, well, there's only a couple of us, we don't feel we need to document it, during COVID, I would err on the side of caution, and I would say you need to document it. It's a difficult time for everybody. We're all working really hard to make sure we're not putting people at risk from transmission of COVID. And the more you can do to evidence what you are doing and what you are putting in place to achieve that, the better. And so that's partly why we wanted to do this session. So even if you think that your group, your organisation is small enough that you don't need to, I would suggest still that you do. You've also got that moral responsibility. When I talk to people when we're talking about work activities, obviously, when people come to work, we expect them to go home safe at the end of the day. So we want to make sure that any risks they may be exposed to, that we've controlled those risks and that we're not putting them at risk. And it's the same for your services and your sessions that you're offering, isn't it? You would hate, I'm sure, for anyone to come to your activity and for them to suffer injury or to feel that they have contracted COVID because you hadn't done as much as you possibly could. Now, when we talk a little bit later on, we're not looking at removing the risk. You can never do that. the only way you can do that is to sit in your house and never go out, never cross the road. That isn't what a risk assessment is about. It's about reducing the risk to a reasonably practicable level. And it's also about only dealing with risks that are reasonably foreseeable. So, for example, you're not expected in your risk assessment to say, well, a UFO may come crashing down into the building that we're in. That's not reasonably foreseeable. It's about those everyday risks that during your activity people may be exposed to. So that's your moral reason. But also there's financial implications as well, isn't there? Because particularly for businesses, but I'm sure for yourselves as well in your groups, because there's the potential for people to make claims. There is the potential for prosecution. And prosecution comes not just with the potential for sentences, but also for fines. And if the HSE were to investigate, they actually charge for the time it takes them to investigate to tell you what you've done wrong. They charge £154 an hour for that privilege, and that's called a fee for intervention. So even before you start, if there was a problem identified, the HSE came in, they undertook an investigation. Even if it was a minor breach that they were looking at, you've still got that charge that could potentially come up. So those three things combined are the main reasons why we have to do risk assessments. So the next question is then, well, who should do the risk assessment? And your ideal person is someone who's got knowledge of the activities that you're delivering. They've got knowledge of the people who are accessing those activities and what their situations and any personal issues there may be there. And it's somebody that knows the locations where the activities are being delivered. And ideally, that is through personal experience. So someone who's got a real knowledge of the work that you're doing, the service users that are coming along, and where you're delivering that. But it also needs to be somebody who understands the risk assessment process, and they know of the control measures. They know about the hierarchy of controls and how to reduce the risk of injury, harm, or transmission of COVID. And hopefully from today, yourselves, you're going to feel comfortable with that. But on top of those factors, it also needs to be somebody who can control the way that the activities are delivered. It's got to be someone with influence and somebody who, if changes are needed to be made, they are in a position that they can make those changes. Now, you might be thinking, well, hang on a minute, we haven't got anyone within our organisation, our group, that fits all of those criteria. And many organisations don't, businesses don't either. And it can be a combination of 3 different people that do that. It can be done amongst a team of people. As long as around that table there is that combination of experience, then you're going to be looking to achieve what is called a suitable and sufficient risk assessment. So that means we've got all the knowledge, we're making it specific to the activity that we're doing, we're applying the correct control measures as we see it, and we are able to make changes that we've identified need to be made. If you get, let's say we get a generic risk assessment that's for COVID for a group activity, that's fine as a starting point, but that isn't the full story. We're not looking at ticking a box. The risk assessment process, it's a living process. It's critical to what you're doing. And just to get an off-the-shelf generic risk assessment isn't specific to your activity. It isn't necessarily addressing risks that may be particular to the environment, to your particular building that you're working in. It won't be looking specifically at your service users. So it's about all of those things combined. Now you might think, oh gosh, there's a lot to this, but every day, everybody does risk assessments, but they do probably what we call a dynamic risk assessment. So when you cross the road, you assess the risk. you look if there's a vehicle coming. And so if there isn't, the likelihood of you getting across that road safely is extremely high. The likelihood of you getting injured is extremely low. If you cross the road when there's a vehicle coming, different scenario. Very high risk of you not getting across safely and getting injured. So how do you reduce that risk? Well, your control measure is you don't cross the road. At that point, you wait and you observe the green cross code, let's say. So it's that, and that at a base level is what we're doing when we're completing a risk assessment. So there are officially 5 steps to risk assessment. I noticed some of you are making notes. We will put out the slides afterwards as well if you want those. So the first step, and I'm going to go through each of these individually, identify the hazards. And one of the areas that people get very caught up on is what is a hazard. So I'm going to try and simplify that for you. We then have to look at who might be harmed and how they might be harmed. And then we're looking at evaluating the risks and deciding on what precautions or control measures we need to put in place. So when we say evaluate the risks, we're looking at the likelihood of people being harmed and to what extent they may be harmed. So it's a combination of those 2 things. And then what do we need to reduce the likelihood of that harm happening? We also need to record the findings and implement them. So that's where I'm saying we need to document the risk assessment. I'm kind of disregarding the number 5 here because I do think we need to do that. We need to record it regardless. And the findings have got to be implemented. And by that, you've got to share the findings with all your volunteers, with your employees, but also with your people attending. Are there things that you need them to be aware of and you need them to do to ensure that they're not going to come to harm while they're in your environment? And then really critical is the final step of reviewing your risk assessment and keeping it up to date. We'll talk about that a little bit later though as we move through. So I wanted to start with hazard and risk. I know personally that when I started in health and safety, this was something that confused me. I know that it still confuses people even when they've worked in the area for quite some time. So I wanted to try and make it as clear as I could. A hazard is a thing or an activity which has the potential to cause harm. So I've given some examples there. So working at height. The risk of working from height is it's quite high that if you fall from height, you're going to have a severe physical injury. It could be life-changing, it could be fatal. If you're using cleaning products, your cleaning products, they're a hazard. And if you don't use them correctly, if you don't have the right control measures in place, the risk is that you may end up with burns, respiratory illness, asthma, dermatitis, etc., etc. Specifically, what we're looking at today, really, I suppose, is COVID. And so you've got 2 hazards associated with COVID. You've got direct transmission and indirect transmission. But the risk from both of them is the same. And the risk is your respiratory ill health, fever, cough, shortness of breath, severe illness such as pneumonia, kidney failure, or sadly even death. So we know that if we do nothing and we allow COVID to transmit between individuals, the risk is extremely high of those outcomes. If we control those risks, we can reduce the possibility and maybe the extent of those outcomes to much lower. Okay. A couple of other things just to illustrate still. Trailing wires, they are a hazard if they're in your environment, and your risk there is of slips, trips and falls. And that's it's quite a good example really, because with trailing wires, with slips, trips and falls, your injury, it can be anything basically. It can be very minor, but it can also be fatal depending on the impact of the fall. And then working with asbestos, where your risk is inhalation of airborne fibres, asbestosis, mesothelioma. with asbestos, that risk is much reduced by not working with asbestos, with having the right control measures in place. And I wouldn't expect any of you in your groups to be doing that, obviously. If you are, let me know. So identify the hazards. So that's what we've gone through there. We've said typical hazards might be working at height, using cleaning products, direct transmission of COVID, indirect transmission, trailing wires, working with asbestos. You might have things like water hazards if your activity is near to water. You may have, and as you were chatting about animals, one of your hazards might be contact with animals and any disease or infection that potentially could be caught, bites from animals, that type of thing. So who might then be harmed and how might they be harmed? Well, it's anybody who can be in the vicinity or affected by what you are doing. So it's employees, it's your volunteers. You've got to have particular consideration as well for vulnerable people, and that includes young workers, so any school children that might be volunteering with your group. New and expectant mothers, they have to have very specific considerations. Trainees and your service users as well, they may have, particularly when we talk about COVID, they may have additional vulnerabilities to that illness. But then other people that you may not have considered, such as cleaners, visitors, contractors that are on the site, carers that may be coming, dropping people off, picking them up, maintenance workers. It literally is anybody who is in your area that you're carrying out your activity. And as we said there, consider particularly if you've got extremely clinically vulnerable and clinically vulnerable individuals attending your setting. There is some specific guidance on enabling safe volunteering as well on the government website. I'm sure you can probably get to that through the Action Together website. So when we look at who might be harmed and how, we've looked at who it might be, and then we look at how they might be harmed. And this is the risk element that we were talking about earlier. So with COVID, we're looking at these here: the respiratory ill health, fever, cough, shortness of breath, severe illness such as pneumonia, kidney failure and death. So those are the risks that we've identified. And all of those, I think you will agree, are reasonably foreseeable. It's reasonably foreseeable that if someone were working at height, that they could fall from height. And if they did, that these are the types of injuries they would result in. It's reasonably foreseeable that if somebody contracts COVID, these are the illnesses they potentially may end up with, or the outcomes that they may end up with. So step 3 is then evaluating the risk and deciding on the level of precautions. So what's the level of risk posed? So is it high, medium, low? Now, at the end of the presentation, I'm going to show you a template that we use in Tameside for our risk assessments, and it's really straightforward, and we have a very simple risk table that we used, and we say it's high, medium or low risk with some criteria. And if you wanted to adopt that yourselves, then you would be more than welcome to. I can distribute a blank template for you. You will see a myriad of different types of risk assessment with all kinds of intricate tables and matrices on how you calculate the risk. There's a score for the hazard, there's a score for the likelihood of the risk. That comes out in a number which you then cross-reference to a table that has a colour as to whether it's high, medium or low. I'm going to say to you now, that's the type of thing that you would expect to see in a nuclear power plant, not in activities that you are delivering. Simple. Let's keep it simple. High, medium, low. And that's what we're looking at. And you want to reduce the hazard, reduce the risk that's posed by the hazard to as low as is reasonably practicable. Now, reasonably practicable means that the cost of implementing that control measure is worth the amount it reduces the risk by. Okay, so if the risk is, let's go back to the trailing wires. So the trailing wires, somebody can trip over those and they can quite severely injure themselves. The types of control measures that you could put into place there are probably going to cost nothing. Move the trailing wires. If they have to go across that area, cover them with some kind of carpet or matting that is clear and evident and isn't going to add a further trip hazard. If it was that it's the trailing wires are there because someone's carrying out work, then the work should be carried out when there's no one around, so nobody is around to trip over those wires. So that costs nothing. So you would be expected to manage that risk and put in place all of those measures. If, however, the suggestion was, right, well, we've got these trailing wires and it's because we are carrying out some maintenance work, and the trailing wires are actually going to be there for half an hour, and we can manage that risk and we can make sure that nobody's in the vicinity on that day. So that's it, costs nothing. The other option might be, well, actually, what we'll do, we won't use that equipment that we purchased a couple of years ago and is still perfectly in good condition and suitable for use. What we'll do, we'll purchase some new equipment at a cost of a few £100 that runs on a battery, so we won't have any wires trailing. There's no point to do that. Why invest that money when you can remove that risk for zero? So do you see what I mean? Sometimes it's quite hard to explain the reasonably practicable, but it is about what you can do. It's got to be worth doing it for the amount of investment. However, if it is high risk and the activity is high risk and the potential outcome is severe, then you must make the investment. So, for example, working at height. You know, when you have someone come look at your roof and they may say, well, you know, it's going to cost this, but I can do it cheaper if I don't use the scaffolding. Well, apart from them breaking the law, but we won't go into that, they should be putting the scaffolding in place at the extra cost, because to have that there, they are massively reducing the risk of someone falling off the roof and injuring themselves. If the scaffolding isn't there, if they aren't using any kind of fall restraint system simply to save money, they are putting their employees and people passing by at significant risk. So hopefully that's giving you a rough idea of that. So the hierarchy of controls that we have to follow when we're looking at risk assessment, the first thing, your first step should always be to try and eliminate or remove the hazard completely. Well, very often we can't do that. It may be that you can change the activity, so you're not going to. So let's say we're crossing the road. To eliminate and remove the hazard, it means we can never cross the road again. We're going to have to stay on the same side of the road the whole time. Well, we can't do that. So your next step down is substitute the hazard or hazardous process and use something less hazardous. Again, you can't use this in every scenario, but if, for example, we're looking at using cleaning solutions, there may be something that is highly toxic, requires lots of personal protective equipment to be worn. You need breathing apparatus to use it, or because the fumes would cause you huge injuries. Well, then simply you wouldn't use that. You would look for a safer alternative to use. Your next option is to put in engineering controls. So when we look at, for example, using machinery, you would usually find on most dangerous machinery that there is a guard system or an interlocking system whereby it will only operate when the guard is in place, for example. Administrative controls are where you put a process that must be followed in place. And you see, with this hierarchy, the first one is an absolute control. As it comes down, then you start to look at, well, there is some human interaction needed here. There's some human responsibility around making these controls work. And so elimination is always top in the hierarchy, it's the best one because that will protect everybody. And as you come down, you're obviously, these are the least preferable, but sometimes these are the only options that we have in order to carry out the activity. So your administrative control is having a safe system in place, a safe process. And for a lot of the COVID control measures, this is what we're looking at. It's about process and managing the situation. And then bottom of the list is PPE, personal protective equipment. And that's because PPE only protects the individual. It doesn't protect everybody. It doesn't remove the risk. The risk is still there. It's your last line of defense. Really key in all of this, particularly with regard to COVID, there's lots of things that we're introducing as new control measures around COVID and the transmission of COVID, but we cannot forget existing health and safety legislation. So, for example, one of the key controls that's been introduced is improving ventilation. And so there's many recommendations about having the window open or having doors open. And this can impact sometimes on fire safety, particularly having fire doors propped open. Now, you can tie that in with having some administrative controls with the doors. You may have them open, but you ensure that they're closed when the building is empty or on leaving. But remember, the regulatory reform order for fire safety says that fire doors should always be closed. So it's about balancing that and not disregarding that existing health and safety legislation. So when we're looking at the precautions, I'm just going to run through now. Now, these are specific control measures around COVID, and I thought just to mention some of these would help you when you're looking at putting together your own risk assessments. And key, number one, ensure that you're complying with the legislation and guidance. Now, I am the first to say there is a myriad of legislation, of guidance rather. There's the legislation, and there's lots to understand around it, and that's a conversation for a different time. We've had many conversations, I think, around what can operate, what can't, what's allowed, what's covered by the legislation. Well, that's a conversation for another day, because that'll take a lot more than an hour and a half, I think, and that isn't going to go away because there isn't always clarity. But you must feel comfortable that what you are doing is compliant. Your key control measure with regard to COVID, remember when we're looking at the hierarchy of controls, remove the risk. Anyone with symptoms should not attend your setting. So there's a number of people really who shouldn't attend your setting, and that is anyone who is displaying symptoms, anyone who is living with somebody who is displaying symptoms, anyone who has had a positive test in the last 10 days, anyone who is living with somebody who has had a positive test in the last 10 days, anyone who has been advised by Test and Trace to isolate within the last 14 days, and anyone who has returned from a country not in the travel corridor within the last 14 days. And that is your number one control measure, communicating that to your volunteers, your employees and your service users, and making it clear that they know we do not want you to come, you must not come if you fit within any of these criteria. Because by doing that, you are massively reducing the risk of introducing COVID transmission into your environment. If you have anyone who comes to your site who is displaying symptoms, they must be advised to go home, self-isolate and get a test. And you need to have a process in place to ensure that can be identified on the door, and that if they have come in, that there is cleaning in place and that you can identify if there have been any contacts. Now, ideally, we don't want any contacts. And again, a key control measure is social distancing, 2 meters. Now, we see, I've seen it, and it's one of the things that's been in government guidance as well, unfortunately, around 1 meter plus. Forget 1 meter plus, it's 2 meters. 1 meter plus is with other mitigating factors. But the other mitigating factors that are often mentioned are face coverings. This will not stop you being a contact in the event that that other person tests positive for COVID. Okay, so you would then, in that situation, if you've been within 2 meters, or I'll go through what the actual contacts are in a second, but you would then still be required to self-isolate yourself for 14 days. You're classed as a contact if you travel in a car with somebody, if you have a face-to-face conversation within 1 meter, if you are within 1 meter of somebody for 1 minute or more, and that doesn't have to be face-to-face, it's just within 1 meter, and you're classed as a proximity contact and would again still have to self-isolate if you are within 2 meters of somebody for 15 minutes or more. Okay, so you can do lots of calculations about what is safe then, what's a safe amount of time to be within that. Don't. It's 2 meters. That's your distancing. That's the simplest way of putting it. So other control measures that you'd need to be considering is frequent hand washing, of course, having your 70% alcohol sanitizer available for people to use. Hello. Also having an enhanced cleaning of your environment. Now, that might not be your direct responsibility, but you're responsible for making sure that it's in place, and you may want to ask the owner of the building to ensure that they leave you with some wipes, cleaning materials, so you can wipe down between. No shared equipment. If there were to be shared equipment, again, it needs to be cleaned down between users. So if you need pens and pencils, everyone should bring their own. No sharing between that. If you're keeping a log of people that have been to the group, perhaps for test and trace, have one person maintain that log, not having everybody sign in separately with the same pen, for example. So there's lots of different things to think about where there may be contact points, and ensuring that there's cleaning between, or those contacts are taken away. And even down to, I mean, it seems utterly miserable, doesn't it? Not providing brews and refreshments. You could ask people to bring their own drinks, bring a flask, bottle of water, but really it's about just keeping those contact points as low as possible. We also do, I mentioned earlier about the good ventilation. That's something which is increasingly becoming a point that is being recommended. There's a new video actually that I've seen today on gov.uk, which is highlighting the need for good ventilation. And I was out with the HSE last week visiting some of the schools, and that was a point that they were really emphasising. So if you're doing indoor activities with the groups that you're delivering, make sure the window's open, even a small amount. It might make it a bit colder, ask people to bring their coats, but just to get that airflow through where you are, it stops the COVID virus droplets sitting in the air. So it's about clearing that air through and getting a good exchange of air in the space that you're in. Probably as well, because you are in an enclosed space, if you're delivering indoors with people you wouldn't normally be with, it is a good idea to wear face coverings. Obviously, if the people are exempt, then you wouldn't be asking them to do so. But that doesn't mean that you shouldn't keep your 2 meter distance. You still need to keep 2 meters distance. Obviously, engage with NHS Test and Trace if you are aware of any positive tests in the setting, or if you're contacted by Test and Trace. What might happen is if an individual tests positive, they advise Test and Trace that they've been in your setting, and they may then contact you to get an idea of other people who've been there who may be considered contacts. But what we want you to be able to say is, no, we know for certain that we have maintained 2 meters social distancing at all times. And that is what you need to be aiming for. If you do become aware of positive tests in your setting, there's an email address there, and that's our population health team, COVID-19, and they would be able to advise you on contact tracing if you needed any help with that. So that's just an idea of some of the control measures. So step 4 in the risk assessment process is to record your findings and to implement them. So as I said, yes, if there's less than 5 volunteers or employees, legally you wouldn't need to, but I strongly recommend that you do. It needs to be specific to your activity, as we've already said. And you need to communicate your findings and control measures to staff, volunteers and attendees. It's no good if you've done a fantastic risk assessment with brilliant control measures if you don't tell anyone what they are. Everybody needs to know what their contribution needs to be to keep everybody safe. And you need to be able to evidence that you've done that. You may not be able to directly evidence that with your service users, sorry, but you might want to ask volunteers just to sign or send an email to confirm they've read and understood those control measures. You need to also make sure that people have got access to those risk assessments in case they need to refer to them. And there needs to be a degree of monitoring or supervision to ensure that the control measures are being implemented as well. Really important, keeping the risk assessment under review and updating it if necessary. It's a living document. It has to be changed whenever there are any changes. So if you move venues, you need to review your risk assessment and change it to make it appropriate to the venue that you're in. If you change how you're delivering your activity, or you change the activity that you're delivering, it needs to be updated on the risk assessment and reflected. If there's a change to the government guidance, you need to review and update your risk assessment. And there needs to be a degree of version control so that you can evidence where those updates have been. Now, this is our template that we use. As I say, I'm happy to send a version out, obviously without our logos, which you can use. You'll see at the top here, you've got the date, but you've also got a review date. Now, normally, we would say to review a risk assessment annually or when there are any significant changes. But in the current climate and with COVID, you might want to say, well, do you know what? We're going to review it when there are significant changes or once a month. And that review doesn't have to be massive. It can just be a quick look over to say, actually, nothing's changed. We're happy with how it is. Or it could be that you need to make some significant changes. Sources here, you might want to list various links to government guidance that you've used or anything from Action Together. And then this is your main body of your risk assessment. So what are your hazards? So we've run through typical types of hazards, but you may have various others according to the activities that you do, but you're going to have at least direct transmission of COVID and indirect transmission of COVID. Who might be harmed and how? Your people who are going to be harmed will be the same pretty much for every hazard. So your volunteers, your service users, employees, members of the public coming to the site, contractors, etc. But how they will be harmed will be specific to that hazard. So we listed them earlier, the different types. Now, your risk rating, I'll come on to in a moment. Remember, I was talking about complicated ways or simple ways of doing that. Your current control measures are what you have in place now to control these hazards and to reduce the risk of harm from these hazards. So you might want to include here the information that you give to everybody about who shouldn't attend in terms of symptomatic individuals or people who've tested positive or people who are self-isolating, for example. You have an increased hand washing regime. You provide sanitizer at the venue. You have got additional tissues so that good respiratory hygiene can be observed while you're there, that type of thing. And then your next risk rating is what the risk rating is when these control measures are in place and observed. So if we had a risk rating of high here, we would want to see here either medium or low. Your next column, are risks adequately controlled, or do you need to do something else? Well, that's where you would put, if you think, actually, we need to put some extra measures in place here. I'm not happy with the level of cleaning we've got, so we're going to put some cleaning. We're going to look at extra cleaning. I'm going to speak to the venue owner and ask them if they can provide us with some additional cleaning materials. And then here, you would say who is going to take responsibility for that action and the date by which it is going to be done. When you do your monthly reviews, or if there's any change, this is where you'd put the date you've reviewed it, who's reviewed it, and just a note of the amendment that you've made. So you're keeping a good track of everything that's being changed. And then your risk ratings, these are the ones that we use within the council. A high risk rating is given where something is likely to happen and is likely to result in the fatality of more than one individual, and there's the potential for a frequently occurring serious and life-threatening injury, right down to low where it's unlikely, but if it does occur, it might result in something minor. Okay, so that does hopefully try and make things a little bit simpler there. And you'll be pleased to know that that is me, finished. I'm sure there must be some questions because I saw some pinging going on up there. So I'll see, Roma, are there some questions that we want to answer?
There's actually only one question that's come through the chat.
Right.
Let me just double check that is the case. So Alison, you talked about some of those contact definitions, keeping 2 meters apart and so forth. Does that apply to indoors and outdoors?
Yes.
Both?
Yes.
Okay. Brilliant. And I think that, I think that's it.
Have I knocked you all into submission?
Roma, I think Cantillao wants to say something from the community centre. Sorry, I see his hand go up.
Yeah, so if you want to ask any questions.
Yes, I got I've got 2 questions, Alison. Thanks very much for your brief on this risk assessment. My name is Ken Mistry. I'm from Indian Community Centre. I'm the secretary, and I'm very much involved in the risk assessment of a community centre. Just to let you know that we have done 3 assessments in our one organization. One is generally for our activities we carry out. We carry out a number of range of activities. And then we are also running Gujarati School of GCSE. So there was another risk assessment requirement by the examination board. So we had to compile that risk assessment as well. And the third thing, we give on hire private tutorial classes, commons. So they had their own requirements. So they carried out risk assessment and sent it to us as such. So we have got on record all these 3 risk assessments. But the question I'm asking, is there any standardization of the risk assessment? I know you mentioned about a template. Now, is there such thing as standardization? Because we have actually done research and there are a number of templates as such. But we want to utilize just one template if it is done by the council.
Yeah, no, and that's the problem. There isn't a standard way of doing it. If you know, the oracle that is Google will throw up hundreds of different types, and the version that we use is based on the HSE template, and that's as simple as I can make it for the work activities that we do in the council. And if you think our range of activities is huge, and that is the risk assessment we use for all of them, regardless of the level of let's say risk, whether it's high risk activities or low risk, we use that one. So that's why I said I'm happy to send that template out. It is based on the HSE one, but there isn't a prescriptive way of doing it, to be honest.
Okay, right. The second question is, Alison, we have carried out all the measures regarding fire and safety and so on. And the inspector from the fire station came, and the first question he asked me, have you got risk assessment as such? So methodically, he went through all my files and he was quite satisfied as such. The question is, you mentioned that it is a legal requirement. is there anybody who would actually come and examine these risk assessment documents at our center besides fire safety officer?
So, right, well, hopefully not, unless you have a major accident at the site. In days gone by, in days of old, when government departments had hundreds and hundreds of employees carrying out these inspections, then that would have been the case. But there is much less, let's say, proactive intervention done. And so unless something goes wrong, it's unlikely. But there is the potential for HSE inspectors or local authority inspectors, and as you've said, the fire service. And the fire service, actually, they would be looking for something a little bit different to these risk assessments. They would be looking for a fire risk assessment, and that is to do specifically with your building and the arrangements that are in place within the building. Now, if you are renting a space on a weekly basis, that wouldn't fall under your responsibility. That would be the, for example, community centre owner's responsibility. It's only if you are in a space it gets quite complicated, but let's say, unless you own a building, let's not worry about that too much at this time.
Right, Alison, and the last question is, we have got, of course, an insurance for the building as such, and luckily we haven't got any major sort of claims regarding any risk with usage of our community center. But are you aware that is there an insurance requirement for this assessment to be done? Is there an insurance requirement?
Yes, yes. Because it's a requirement of health and safety legislation. The legal requirement for risk assessment it comes from the Health and Safety at Work Act and the Management of Health and Safety Regulations, and you would be expected to be compliant with that as part of your insurance process anyway.
So do we need to submit this risk assessment to our insurance when we renew it? No.
No, but it's got to be in place.
Yeah, okay. Thanks so much, Alison. Thank you.
Problem.
Okay, so we've got another question in the chat box, and I've noticed that a couple of people have turned the mics off, and I'm thinking that you want to ask a question. So if I ask the chat question first, and then I'll open it up to the floor. So we've got a question from Sadiq. In relation to COVID-19 risk assessments, do they have to be done by a COVID compliance officer only, or can anyone in the organisation do it?
No, because not everyone's going to have a COVID compliance officer, and it's new for all of us, to be honest. Your main criteria around your risk assessment is about knowing about your activities, and then so it doesn't have to be done by a COVID compliance officer now.
Brilliant. Okay. Okay, so I'm going to turn off the screen sharing just so everybody can see. I think you've got that, haven't you, Alison? Yeah, so you can open it up. That was just a request from one of the participants. Right, so I think, Tony, you've got your mic off. Did you want to ask a question?
Yeah, can you hear me now? Yeah?
Yeah.
Okay, thank you very much. Yeah. What we found with, we've had a risk assessment from the Crown Cream Bowling Association recommendation, and we've also followed the guidelines in respect of Tameside's. And I would appreciate if you could send me a copy of the, that actual documentation piece. That would be superb. But we have had issues because if you can appreciate, and it's not an age thing, and it is an age thing, but a lot of our members, trying to get the message over, especially some of our members who have dementia or forms of have issues, and we welcome everybody. We have tried to keep everything outside. We have, but it has been difficult to get the message across to people who are not as receptive or understanding. And we're looking now at having to suspend them sessions, especially in this recent lockdown, because the risk is too great because we can't get the message over. So Everything you said, excellent. I mean, it was a great presentation, and what I was pleased with, it did firm up what we believed, and so I'm happy with that. But you know, there are going to be times, unfortunately, where we will have to withdraw some of our projects. Like we've got the, well, if we come back, I'm trying to be positive, but when we come back in the 2021 with maybe a better situation, we're still, am I right in thinking we still have to keep these in place? Am I right in saying that, Alison?
Yeah, and I mean, hopefully one day in the future, when you know, we're just living with COVID and it is controlled by other means, but you'd still need your risk assessments for other areas anyway. Yeah.
Okay, thank you very much. Thank you.
Thanks, Tony. And then sorry, I muted Stephen Folds. Stephen, did you have a question? Because you were unmuted.
Hello, can you hear me?
Yes.
Hi, Stephen. Yeah.
Yeah. No, sorry. No, I didn't have a question. No, sorry. I don't know. I'm unfamiliar with the technology. You'll have to excuse me. I'm a Luddite, so this is all new to me. Thank you very much for tolerating me, but no question.
Brilliant. That's good news. Emma, did you have a question? Because I noticed you went like this with your hand.
Yeah, it was just around the compliance officer, because you know, do organisations need a main contact compliance officer? You know, a named officer, like you would have a safeguarding officer in an organisation, or could that be anybody? Does it need to be a COVID compliance officer of some sort?
No. You're looking at, you as an organisation. When I was talking about completing the risk assessment, it's not necessarily going to be one person. So it doesn't, it's about sharing those responsibilities and having the best people for each of those criteria, basically. And if you need advice, it's about getting advice from the right place.
Well, why I was asking, if something was to go wrong within an organisation, if the council or public health or health and safety was to get in contact with somebody, having the named person of somebody that they can say, okay, who's the main person within that organisation that they can talk to about the risk assessment might be ideal. But it might not be a COVID compliance officer. It can be somebody that's named as a kind of a lead within an organisation. That's what I'm trying to get to. Yeah, it doesn't. It can be either or.
Yeah, absolutely.
Okay, thank you.
Welcome.
Thanks, Emma. So I don't think there's any more questions. If there is, we've got one from Anna.
Yeah, I have a quick question. It was just about if you had a query about a risk assessment or something that you just wanted to check out, who would be the contact at the council to go to? Would that be you, Alison?
Yeah, you could send it through to me, or you could send it through to Action Together, and they will forward it on to us.
Okay. That's
Sorry,
great.
I went blank then for a minute.
Okay.
Yeah, so if there is any questions, you can contact us as well, Action Together. As Alison said, we're happy to sort of answer what we can, and obviously bring Alison in for those more sort of specialist questions. I can't see any more hands or anyone's mic unmuted. So everyone happy with the session? Okay, I'm going to stop recording. Thank you, Alison.